Welcome back. This section of the show is called Ask FPA. You can send your medical questions to tv@fpalex.com and include your name if you'd like for us to use it on the air. Tonight's question is, what is a continuous glucose monitor? Asked by Bill Harrison of Lexington, Kentucky. And here to help me answer that question is Miss Ashley Sparks, who's a physician assistant with Family Practice Associates. Welcome.
Thank you.
All right, I teased the show new ways to monitor glucose. Well,
Yes.
before we get into the new ways, let's talk a little bit about what's the numbers we should be looking for to start with.
So to diagnose diabetes, we can look at a few different things. In a patient who has eaten, we're going to look for a blood glucose greater than 200. If they haven't eaten before their labs, we're going to look for a blood glucose greater than 125. Or we can look at a hemoglobin A1C, which is a 30-day average of the blood sugar. I'm sorry, a 90-day average. And we would look for that number to be equal to or greater than 6.5%.
Okay, now that's the diagnosis of diabetes.
Yes, sir.
But sometimes if you creep up, get close to that, it's called pre-diabetes.
Yes.
And that's the time you want to catch it before it gets to be diabetes.
Preferably, yes. That's when we would like to catch it and start making changes at that point.
All right, now let's talk about the way, the routine way, the way most people are monitoring their sugars is by a finger stick.
Correct.
Tell us about that.
So the finger stick, if patients on insulin, they're probably sticking themselves anywhere from 4 to 6 times a day. For non-insulin patients, you're looking anywhere from 2 to 4 times a day. And they would use a glucometer.
You brought one with you.
I did bring one with me today. And this is just one example, but they all look similar. And you would insert a test strip, prick your finger, blood on the test strip, and it gives you a number.
And that little machine, it's at the time, it's what your sugar is at the time,
Yes.
and it saves those so you can look at them time, one at a time.
Correct.
But there's some new ways to monitor your sugar.
There are, and that's where we get into the continuous glucose monitors, or the CGMs. These are wearable devices, 2 different types. The personal device, which can be worn typically from 10 to 14 days. It will monitor your sugars about every 5 minutes. Some of them will send updates to your smartphone and tell you if your sugar is too high or too low, but they really just replace the finger stick glucometer.
Now you brought one with you,
I did.
and just show us that and what it does.
I have an example of this one. This is one that you would wear on the abdomen. This is one that will give alerts, and it also works with insulin pumps for anyone who's on a pump. You can either get a receiver, which will show your blood sugar and a graph, or you can actually have this one synced to your smartphone or even your Apple Watch. So you can get readings that way as well.
And that little device sticks somewhere on your body.
Yes, sir.
Where would you wear that?
This one you would wear on the abdomen, on either side. You can also wear it on the upper back. I've actually worn this one, and I have to say it's comfortable. You don't really notice it's there once you put it in. There's a different one that goes on the back of the arm as well.
Okay, so this is monitoring, you said how often?
About every 5 minutes.
So what do you do with that information?
So you can do a few things. You can look for trends. Does a certain food always cause your blood sugar to go way too high? Are you dropping way too low at night? And you can also, instead of pricking your finger to determine how much insulin you need, if you're on a sliding scale, you can just look at your meter.
You can also take that information, download it, and let your provider look at it and make adjustments.
Yes.
Now, that's usually adjustments to insulin or medication or food or all of that.
All of the above.
Okay. Now, we talked a little bit, mentioned insulin. You also brought some pens with you, but before you get to insulin, there's also some other medications, but they are injectables.
Yes, so there are some newer medications out that most people have probably heard commercials for. They're insulins that help, or I'm sorry, they're medications that help your body use your insulin better. So this is for patients who are still making some insulin. Most of these are once a week injectable. They're very easy to do at home, and we can do the training in the office.
You brought one of those with you also.
I did bring in one of those. So these are single-use pens. So you use it once, the needle retracts back into it, throw it away, and you're done.
And that's once a week.
Once a week.
Pretty easy to do then once a week.
Yes, sir.
And insulin's not as hard as it used to be. You don't have to draw it up in a vial and inject with a needle. It comes in a pen also.
It also comes in Easy Pen. And it's so much easier than the vial and the needle. Just got a little crank on the side, and you just turn it up to whatever your dose is and push the button. That's
Easy enough.
it.
All right.
sir.
Now, you have a focus at Family Practice on diabetes care. Tell us a little bit about the program at Family Practice.
So we're trying to take a team-based approach to diabetes management. That team, of course, includes the patient, our most valuable player, the patient's primary care provider, myself, and a registered dietitian. So if I see a patient, we would take time to review what medications have already been tried and failed, look at their lifestyle, see what dietary changes we can make. If they had a CGM study, we would review that to see if there's a better way to optimize medical therapy.
CGM's continuous glucose
Continuous
monitoring.
glucose monitors, yes. And set individual goals.
Well, that's great information. We appreciate you coming in, and look forward to you working with us at Family Practice.
Great. Thanks for having me.